Are you struggling with breastfeeding while your baby is teething? If so, you're in the right place, and let's dive into this often challenging stage of motherhood. Breastfeeding and teething can seem like a daunting duo. Your baby is experiencing discomfort, and you, on the other hand, are trying to provide the essential nourishment they need. It's a delicate dance, but one that many mothers have successfully navigated. During this period, your baby's gums are tender and swollen as new teeth make their way to the surface. This can make breastfeeding a bit more challenging, as they may bite or refuse to nurse due to the discomfort. It's a common issue that new mothers face, and we are here to discuss it openly. Remember, as tough as this might feel right now, it's an entirely natural part of your child's growth and development. You're not alone in this challenge, and we're here to help you navigate through it. Understanding the connection between teething and breastfeeding can help you better manage the situation. When a baby begins teething, it's a significant milestone, marking the start of a new phase in their growth and development. However, this period can often coincide with breastfeeding, creating a unique set of challenges for both mother and baby. Teething can make breastfeeding difficult for a number of reasons. Firstly, the discomfort and pain caused by the emerging teeth can make the baby irritable and fussy. This can result in the baby latching onto the breast incorrectly, leading to soreness and pain for the mother. Moreover, the increased production of saliva during teething can cause the baby to gag or choke during feeding, making the process uncomfortable for them. This, in turn, can lead to a decrease in their appetite, thus affecting their feeding patterns and potentially their overall nutrition. Additionally, the process of teething can disrupt the baby's sleep patterns. An uncomfortable, restless baby might demand to be fed more often, leading to exhaustion for the nursing mother. This can be a trying time for mothers, especially those who are breastfeeding for the first time. But it's not just the physical discomfort that's a challenge. The emotional toll that this phase can take on both the mother and the baby is significant. It's normal for the baby to be more clingy and for the mother to feel overwhelmed or anxious. Understanding these factors helps us appreciate why teething can make breastfeeding difficult. It's a complex interplay of physical and emotional factors that affects both the mother and the baby. However, it's important to remember that this is a temporary phase. As the baby's body adjusts to the new teeth and the mother learns to adapt to the changes, the situation will gradually improve. It's all part of the incredible journey of growth and development that both the mother and the baby are on. This understanding lays the foundation for us to explore effective coping strategies. Let's hear from the experts, lactation consultants who can guide us through this challenging time. These professionals have a wealth of knowledge when it comes to breastfeeding, especially during the teething stage. Firstly, adjusting your nursing position can make a world of difference. Some consultants suggest the laid back or biological nursing position, where you lean back and allow your baby to latch on from above. This positioning can help reduce the pressure on sore gums and make nursing more comfortable for your baby. Another suggestion is to nurse more frequently but for shorter periods. This approach can help because your baby's mouth may be sore, and long nursing sessions can exacerbate the discomfort. Short, frequent feedings can help keep your baby nourished and hydrated without causing additional pain. When it comes to soothing techniques, there are a few that lactation consultants often recommend. One popular technique is to use a cold, damp washcloth for your baby to chew on before nursing. The cold can help numb the gums and reduce pain during feeding. Alternatively, you might consider using a teething toy or ring. These are designed to be safe for babies to chew on and can provide a great deal of relief. It's also worth mentioning that some mothers find using a nipple shield can provide some protection during this time if your baby tends to bite. Lactation consultants also stress the importance of staying calm and patient. It's understandable to feel frustrated when your baby is struggling with nursing due to teething pain. But remember, your baby can pick up on your stress, which may make nursing even more difficult. Try to remain calm and comforting, reassuring your baby with your touch and voice. Lastly, don't hesitate to reach out for professional help if you're finding things tough. Lactation consultants are there to support you and can provide personalized advice based on your situation. Remember, every baby is unique, so it may take some trial and error to find what works best for you and your little one. This journey of breastfeeding during teething is a shared experience, but it's also a very personal one. Trust your instincts and know that you're doing the best you can. Now let's turn to the pediatricians to understand the health aspects of teething and how it can affect breastfeeding. Teething is a natural process, but it can also be a challenging period, both for the baby and the parents. As the new teeth push through the gums, your little one may experience discomfort and become fussier than usual. This can potentially affect breastfeeding as the baby might be reluctant to nurse due to the pain. Pediatricians emphasize the importance of maintaining your baby's health during teething. Regular checkups are crucial as they allow the doctor to monitor your child's growth and development and address any concerns that may arise. Remember, it's always better to ask questions and clarify any doubts you may have than to worry in silence. According to pediatricians, some babies sail through teething with no issues whatsoever, while others may experience symptoms such as drooling, irritability, and a slight increase in body temperature. It's important to note that a high fever is not a typical sign of teething and should not be ignored. If your baby has a high temperature, it's best to consult with a healthcare professional as soon as possible. The baby might also have a decreased appetite for solid foods during this period. If you notice this, don't panic. It's okay if your baby temporarily loses interest in solids. Just continue breastfeeding as breast milk is a complete source of nutrition for your baby. Teething can also affect a baby's sleep patterns. They might wake up frequently at night due to the discomfort. Try to maintain a calm and soothing environment to help your baby sleep better. Gentle massages, teething toys, or a cold washcloth can also provide some relief. In conclusion, teething is a milestone that every child must go through. It can bring about changes in your baby's behavior and affect their feeding habits. But with understanding, patience, and regular healthcare checkups, you can navigate through this stage effectively. The health of your child is paramount, and recognizing signs of distress can help ensure their well-being. Now that we've heard from the experts, let's talk about practical tips that you as a mother can employ. First things first, maintaining a soothing environment for your little one can go a long way. This is not just about the physical space, but also about the emotional ambience. Your baby can sense your mood and emotions. So even amidst the challenges of breastfeeding and teething, it's important to stay calm and patient. Your serenity will help soothe your baby, making the process easier for both of you. Another practical strategy is the use of teething toys. These come in various shapes, sizes, and materials, so you're sure to find one that your baby loves. Teething toys can provide a safe and effective outlet for your baby's teething discomfort. They can chew on these toys, which can help alleviate gum soreness and distract them from the discomfort. Don't forget about your health too. It's easy to get so wrapped up in caring for your baby that you neglect your own needs. But remember, a healthy mom makes a healthy baby. So make sure to eat well, get enough sleep, and take some time for yourself every now and then. You might find that a quick nap or a relaxing bath can rejuvenate you and give you the energy to face your nursing challenges with a positive attitude. And what about when things get really tough? It's okay to reach out for help. Whether it's from a spouse, a family member, a friend, or a lactation consultant, don't hesitate to ask for assistance when you need it. You're not alone in this journey, and there are people who are ready and willing to lend a hand. Remember, every baby is unique, and what works for one may not work for another. It might take some trial and error, but you'll eventually find the strategies that work best for your baby. In the end, it's about finding what works best for you and your baby. Breastfeeding while your baby is teething can be a challenge, but remember, you're not alone. Throughout this journey, we've explored the complexities of teething and breastfeeding, the trials and tribulations many mothers face, and the solutions that can make this process a little easier. We've delved into the wisdom of lactation consultants, their insightful suggestions, and the health considerations that come into play when your little one is cutting teeth. We've also looked at practical coping strategies, from offering teething toys to adjusting feeding positions, that can help ease your baby's discomfort and ensure a smoother breastfeeding experience. The importance of expert advice and the application of practical, tried and true strategies cannot be overstated. Remember, this is a journey, and it's okay to ask for help and seek support. Take it one day at a time, and remember to take care of yourself too. You're doing a great job, and we're here to support you every step of the way. We hope you found this video helpful and it has given you some relief to know that you're not alone in this journey. If you'd like to continue receiving valuable content like this, please consider subscribing to our channel. Each video we create aims to provide you with the support and information you need during these important milestones in your child's life. And don't forget to hit the like button if you found this video useful. Sharing this video with other mothers can also help them navigate through their own breastfeeding and teething challenges. We truly appreciate your support. Thank you for watching, and remember, you're not alone in this journey. We're here to help you every step of the way.